Hi, I'm Dr. Reggie Eady, President and CEO of Trinity Health of New England. Throughout the COVID-19 pandemic, we've been focused on caring for and serving the patients of our community. We've also been committed to providing you, our community, with continual and timely information and education around COVID-19 to make sure you feel prepared and safe. We are proud to be partnering with the Greater Hartford YMCA to ensure a safe environment and a positive experience for all members and colleagues of the Y. I hope you find the short video you're about to watch from Trinity Health New England helpful and informative. I also want to take a moment to let you know that Trinity Health of New England is here for you. If you recently had to postpone doctor visits, surgery, screenings, or other exams, now's the time for you to get back on track because wellness shouldn't wait. We are taking extra safety precautions in our hospitals and offices, and we are proud to offer comprehensive virtual care, making it easier to see a provider from wherever you are. Feel free to visit your Trinity Health of New England website at trinityhealthofne.org to learn more about our programs and services and to find updated information about what you need to know about COVID-19. Stay well, stay safe, and remember, we are all in this together.
Hi, and I'm Harold Sparrow, President and CEO of the YMCA Greater Hartford. We are grateful to have a strong community partnership with Trinity Health of New England. Over the past 3 months, our teams have collaborated to make sure that we follow the CDC and Connecticut state guidelines to reopen our Ys and day camps, and we are working together to ensure the health of our communities through collaboration, commitment, and caring. I want to personally thank Dr. Eady for sharing Trinity's best physicians and thought leaders to visit our Ys, review our safety protocols, and recommend best practices to create a safe and respectful return experience for our members and staff. Our YMCA is unique in that we have partnered with Trinity to not only provide a sense of comfort for your return, but also it allows you to access traditional healthcare resources that will help strengthen your body, mind, and spirit. Knowing that we have been diligent and thoughtful in creating safety protocols, we are well prepared to reopen our YMCAs with confidence. Trinity's motto is, we are all in this together. The YMCA's credo is, we build lifelong success. When you blend the statement, it reads, we are all in this together as we build lifelong success.
Hello, my name is Jim Mazo. I am the Regional Medical Director of Occupational Health and Safety at Trinity Health of New England. We're going to discuss COVID-19 and what the YMCA has done. We have two major learning objectives. One, what policies and public health practices have been implemented to keep you safe? And what can you do to keep yourself and the membership safe while working out? Three major takeaways of which everyone's heard about the coronavirus. One, wash your hands. It's very important. Use tissues, cover your cough, and also avoid touching your face. COVID-19 has really changed the way we will do business and the way we conduct social activities. The virus is very effective at transmission from person to person. It's affected how we work and how we play, and we'll discuss the implementation of work strategies to minimize risk to employees and our clients. The virus has two major venues of spread. First, person to person, and the second is contact. Person to person spread is between people in a close contact within 6 feet of you. It can also be spread via respiratory droplets in a cough or sneeze, which can travel very far. Droplets can land in the mouth or in your nose of people nearby, or possibly inhale deeply into the lungs. Secondary contact with infected surfaces is another way that the virus is spread. This is touching an object that has a virus on it and then touching your own mouth, nose, and eyes, causing self-inoculation. There are several strategies that have been implemented by the YMCA to help minimize disease spread. This will be screening and temperature checks as you come in, increased use of hand washing and hand sanitizers, mask use, social distancing, of both people and equipment, and a high disinfection of surface and gym equipment rate, and increased HVAC in the building. The temperature checking will occur as you enter the building. It'll be used a no-touch infrared thermal scanner. All members will be screened at the entrance, and a symptom questionnaire will be reviewed. It's very important to prevent transmission of disease by washing your hands. This is a strong component of the self-contamination with hand-to-face contact. With hand cleansing, 20 seconds, or saying the alphabet with soap and water and making sure you wash both sides of your hands, or using an adequate amount of alcohol-based hand sanitizer for 20 seconds as well. If you look at the diagram, be a germ buster, you can see to apply soap, wash for 20 seconds, rinse and dry, and then turn off the water with the paper towel you just dried your hands off with. Masking is important to prevent transmission. Respiratory droplets can travel up to 6 feet, and that's simply speaking. Sneezing and cough aerosolizations can travel up to 25 feet. Keeping at least 6 feet away from anyone that you don't live with is an important role in social distancing. The natural elements that may be at work in your favor if you're exercising outside would be breezes, air currents, rain, and sunlight. The virus is also less likely to be passed in well-ventilated areas and buildings, and the YMCA has taken precautions to do that. You'll notice in the picture, this will not be the typical gym situation that you're used to seeing. There will be social distancing of workout equipment. There'll be alternating positions for the exercise bikes and treadmills, limited and modified free weight usage, increased air exchange, and mask use when not actively exercising. Disinfection is very important. The virus itself is easily killed by soap and water and multiple commercially available cleaning products. Surface will be cleaned very frequently to prevent the spread of disease, focusing on the equipment, toys, doorknobs, faucets, and toilet flushes, things that sometimes aren't routinely cleaned on a daily basis. So what can you do if you get sick? First, put a mask on. Check your temperature. Do not go out into stores or go to the YMCA. Call your primary care physician. If you don't have a primary care physician, you can obtain one at trinityhealthofnewengland.org and then get tested for COVID-19. The swab testing, the SARS-CoV-2 test, is the nasal swab test that determines if you are sick from the virus and have COVID-19 disease. These testing facilities are available at St. Francis Hospital, St. Mary's Hospital, Johnson Memorial, and Mercy Medical Center. The COVID-19 call center is there to assist members who want to make an appointment at one of our 3 drive-through testing sites. The call center number is listed and is available Monday through Friday, 8 to 4:30 p.m., and also limited hours on Saturday. The SARS-CoV-2 antibody test is the antibody that checks to see if you were exposed to the virus and your body has formed antibodies. This is also available at Trinity Health of New England Hospital blood draw stations and satellite blood draw stations. You do need an order from your primary care physician. If you do not have a PCP, again, trinityhealthofne.org.